I have checked the order for my patient and I will be doing an assessment and deliver care. So I'm going to be foaming in, knock knock. I have checked the door for any special precautions that the room might have, like airborne or droplet precautions. It appears to be no precautions, special precautions. So I'll come in, introduce myself. Hello, I'm Ira from respiratory therapy. Can I come in and do an assessment for you? I heard that you have a breathing treatment order today. And then I will proceed to, may I ask for your first, last name, and date of birth, please? And they tell me, okay, hi, Mrs. Williams. It's good to see you. And I will put on my gloves. I will scan the wristband of the patient to confirm for the identity. And then after this, I will proceed to do the assessment, auscultation, using a pulse oximeter to measure their SpO2 and heart rate, and then I'll be doing their vitals. So then on to checking their head, ears, eyes, nose, trachea, and neck. So there's no diaphoresis noted, no nasal flaring also that I'm noticing, no tracheal tugging, no pursed lip breathing. I'm also not seeing any cyanosis in the fingertips or lips. There's no edema as well. And the trachea appears to be not deviated. It's within the midline. There's no shifts, no stridor, and carotid pulse noted. There's also no JVD, and so no JVD, and then on to just looking at the overall patient's chest, and there seems to be bilateral expansion, although there appears to be a barrel chest or an increased AP diameter. So I'm going to go ahead and listen to the patient's lung sounds. I'm going to have you breathe regularly for me and take deep breaths in so we can listen to your lung sounds, okay? Is that okay? Okay. Take a big breath in. Top, across, and then percussing. So upon auscultation, inspiratory and expiratory wheezing is noted, and then for percussion, there's no hyper or hyporesonance. The heart sounds, there is normal S1 and S2 with a great rhythm and normal rate. And I'll also be checking for the patient's abdomen now. So there appears to be no abnormal distension of the abdomen. And we will move on to proceed to looking at their extremities. So there is no sign of digital clogging. I'm going to be pinching the fingers to assess capillary refill. It looks like there's good blood flow return, less than 2 seconds. There's also no cyanosis. My patient also doesn't have any fetal opening edema, and which is indicative of fluid retention. And to check for that, you would be just pressing on the toes and foot area, and then proceed to checking my patient's vitals. So I will go ahead and put a BP cuff on your arm here. I'm going to close the valve, pump it to 180 to 200 millimeters of mercury. And then I'm going to release the valve now. The first sound that you're going to hear is called the systolic pressure, and our patient will be at 130. And then for that last beat you will hear is the diastolic pressure, and the patient will be at a 72. So tell the patient looks like your BP is good. And then I will pull up the vitals. My patient's heart rate is 89. Normal is 60 to 100. My patient's respiratory rate is 16. They're normally, that's within range since the normal range is 12 to 20. The temperature is 98.7 degrees Fahrenheit. And I am using a pulse ox now to measure the patient's heart rate and SpO2 level. And it seems that my patient's oxygen saturation is low. It's around 72%. It looks like your oxygen is low. I'll place you in a bit of oxygen to help raise that level back up. Is that okay with you? Say yes, it's okay with me. And I'll proceed to placing a nasal cannula, attaching it to the oxygen in the wall, and starting them on 2 liters, and then asking your patient if the nasal cannula feels comfortable. I'll put them on a nasal cannula on 2 liters. So I'm gonna have my nasal cannula. I'll just put that right there for 2 liters. Alrighty, so does the nasal cannula feel comfortable? Yes. Okay, awesome. And then I will proceed to read the ABG gas results for a patient. So just an appropriate levels for pH, the CO2, your oxygen, and HCO3. For pH, it has to be 7.35 to 7.45, but the patient appears to be at low pH at 7.34. And then the CO2 level would be around 35 to 45, but the patient here we have has a CO2 that's elevated to 67. Her oxygen is around 73, indicative of mild hypoxemia. HCO3 is at 26, and it's within range as well, because normally it should be at 22 to 28. And so this ABG shows uncompensated respiratory acidosis with mild hypoxemia. And then I will pull up a chest x-ray. I will say that the chest x-ray is showing hyperinflation or extra air. But although, and then you want to check the quality of the image. So it looks like there's good exposure on the chest x-ray to give you that optimal image. So because my patient is wheezing, we're going to give a nebulizing treatment. So you will explain to your patient further. So here I have is a nebulizer. I'll put medication in here called DuoNeb. It's 2 medications to help open up your airway in your lungs. And I'm gonna go ahead and connect this to the wall air. And then you're gonna tell your patient to have a good seal around the mouthpiece. And then, so this treatment's gonna be the treatment's about to be 5 to 10 minutes. If it ever gets uncomfortable, because it might make your heart beat a little bit faster, I'll be here the whole time if it gets uncomfortable, and we can stop the treatment. So then, after treatment's gone, you're going to tell your patient the medication is given 4 times daily. And then you're going to also check I don't have my SpO2, but you're going to check the new SpO2 level of the patient now that you put them on the nasal cannula. So for this scenario, let's say the patient now will be at 92%. And then I'm going to take a listen again here, Mrs. Williams, for your lung sounds. Take a big breath in for me, please. Thank you. Sounds like there's more air in there. It definitely sounds like it's clearing up as well. Okay, thank you. So now that you have done that, next would be your informing the patient basically of the medications they will be taking home. So the patient with an albuterol, 2 puffs every 4 to 6 hours or as needed, and then a Symbicort twice daily medication. And then I also might tell my patient that I'll send you a spacer as well, and a spacer will help you get the medications deep into your lungs. And you proceed. So now the assessment's completed, and you want to thank your patient. So thank you, Mrs. Williams. I will see you here again in 4 to 6 hours for another treatment, okay? Do you have any questions for me? Proceed, no questions. All right, here's your patient slide. If you need anything, just press the nurse's slide, okay? Is there anything else I can get you before I go? Okay, no warm blanket. Maybe move your remote closer to you. Okay, so if I've done that already, I want to make sure to lower the patient's bed. So lowering the patient's bed, and then now I'm able to foam out, clean my equipment, and head out.